Well, it can take a lot of work to keep your skin clean and younger looking too.
In a segment sponsored by Fargo Center for Dermatology, Dr. Rachel Ness and Nikki Welk are here to talk about what treatments you can get for a healthier, younger looking skin. To both of you, good morning. Happy Friday.
Good morning. Thank you for having us here today.
So what is the key? I mean, everybody obviously wants to have that forever. So what's the key?
Probably our number one thing I talk about is, first of all, is protection. That's the easiest thing. Prevention is always the easiest thing. So we talk about sunscreen, sun prevention, and then there's, again, lots of things that you can do in regards to cosmeceuticals, other topicals to kind of keep that skin up to speed. And then also making sure that you're not missing anything. So regular skin exams also is important to make sure that we can intervene earlier than later for things, skin cancers or other lesions of concern, so we can minimize those interventions and scars.
Well, I've heard that before, that it's better to prevent something than to try to treat it after, an incident happens. So is that usually the age group that you're seeing is the younger group, or is it kind of a big wide range?
Really we see, newborns, we see the elderly, we see everyone in between. And I think that's the beauty. We've been in South Fargo for 10 years, and over time we've gotten to see family units really develop in our clinic. So maybe in the beginning I saw grandpa and grandma for skin cancers, then over time, they have a 30, 40-year-old child who now I see husband for hair loss. I see wife for, cosmetics, lasers, those types of things. And then over the last 10 years, they've had 3 kids. So I see the adolescent for acne. I might see another one for a rash, psoriasis, warts. So, it's really, really neat over time. My patients bring in their brother, their cousin, their uncle, their grandma. So we really treat the whole spectrum. And I think that's the beauty of being a dermatologist is, we really see it all. Anything that involves skin, hair, nails, really that's involved in being a dermatologist and being in private practice.
Let me ask you this, because it's such an incredibly business, meaning skincare, and so there's all these different products when you walk into a shop. Like, what should you be looking for if you're thinking, okay, I want to keep my skin looking young? What should I be looking for that particular product I'm going to use?
I think that's a lot. Nikki Welk is my physician assistant, so her and I at our clinic really spend a lot of times educating our patients. And I don't think that there's one product in particular. Patients might come in and they're asking for that one particular product, but really it's asking, what is their concern? What is your concern? What are we trying to prevent? What are we trying to treat? And really coming up with a comprehensive skincare plan for them in regards to treatment and for prevention. And it can be really overwhelming for patients, coming in. So coming in and having a consultation and finding out, your skin type, is probably drastically different than Chris's skin type. And so it's not a, one plan fixes it all. It's very tailored really to everyone's particular type of skin types, acne prone, oily prone, eczema, sensitive, and we do, for convenience, we do keep a whole skincare line, really developed by myself over the 10 years that I've been there to really make it easier over time, because I've really noticed over the last 10 years that patients, they want good skincare and they really want help, picking those out, because it's such an overwhelming topic, I think, to all of them.
I was going to say, sometimes they're coming to you with big struggles. So, Nikki, I'm sure you get to see them leave feeling happier and more confident, too.
Yes, we really do. So it's great as far as doing, comprehensive skincare. We do offer cosmetic consults, too, which I think is great that we provide. We have a registered nurse, Kari, or Dr. Ness or myself do offer those, and it's great to just kind of come in. We look at the whole picture as far as prevention, treatment, and really get an overall skin regimen for the patients, which I think is great too.
Yeah, so walk me through that. I walk in, I get a cosmetic consult. What am I going to leave with?
Really, when you come in, one is during your cosmetic consult, one is we ask you, what's bothering you? We hand you a mirror, so don't be scared. That's the first thing that we do. We say, what's bothering you? And then we step back and say, okay, that's interesting, because one of the things is I noticed on you was I actually noticed this. So it really is, patients might come in and say, no, I'm actually here, I need Botox, I need fillers, I need lasers. And I say, well, you might, but actually I think before we consider adding, that Botox or doing that laser, maybe we need to fill, maybe we need to add more structure to your face before we try and rejuvenate that collagen. So what you can anticipate is coming in, what might be the best fit, to meet the needs. You might have thought you were coming in for one type of procedure, but maybe we'll pick something that we think is maybe a little bit more appropriate. You'll leave there with a price, an expectation. Probably what we found over time is our patients want results and they want no downtime, So one of the things is we found over the years is finding modalities and interventions to be able to offer that results in no downtime.
I love that. All right, stick around. Much more on keeping your skin glowing and looking young right after this.